My name is Thain. I was born in Leicester. I went to school in Leicester and then college in Sheffield. I got married in 1978, had my children in 1984 and 1986, where I actually had very severe postnatal depression. With my first daughter, it was immediate. I did have a miscarriage before that, but it was immediate. With my second daughter, I was determined I wasn't going to be depressed. However, after 6 months, I was depressed. It came upon me again. I then had probably another bout of depression when I lost my husband very suddenly in 1992, and another bout of depression in 2000, which I don't know really what that was all about, particularly in terms of major events. But when I was diagnosed with cancer in 2012, in March, the depression did return, and it was inevitable, I think. Right, my name is Sue Thain. I was born in Leicester, went to school in Leicester, went to college in Sheffield to train as a PE and maths teacher. After I'd been there for 2 years, decided it wasn't for me and joined M&S, Marks and Spencer, as a trainee personnel manager. I then moved around the country literally every 6 months as a trainee, so I've lived literally all over the place. Met my late husband through M&S, and we met in 1977, got married in 1978, both still working for Marks and Spencer. And at that time we were living in Frimley Green in Surrey. I had my first baby in Brighton. I moved to Brighton 8 weeks before she was born, still working with M&S. Returned to M&S after I'd had Claire part-time, although I'd had terrible postnatal depression, which I didn't have to go into hospital, but I was very poorly and had a lot of help at home for the depression. I recovered after about 6 to 7 months. We then got moved to Cheshire. We moved up to Cheshire with my late husband's job. And whilst living in Cheshire, which was for 3 years, I had my second daughter, Laura. I returned to M&S part-time during this time. And then I moved eventually back to Leicestershire with my husband's job again. And we settled here in Broughton Astley. Unfortunately, in 1992, my husband had also shown signs of depression. Not that it was particularly noticeable, but it was to do with his job, not knowing what he really wanted to do, but deciding he couldn't keep moving around with M&S, which is what it would have meant. So he did have some treatment and medication, but sadly, he actually couldn't cope with that, and he committed suicide in 1992. And I had my 2 daughters of 5 and 7 at that time. Had lots of help from family and friends who all lived around. My family luckily did. My parents had been in Germany but moved back to Leicestershire. Father took early retirement. And again, after a few months, I had a very, very severe depression, which did necessitate me going into hospital. I was probably in hospital for about 3 to 4 months, and then gradually picked up the pieces, returned to M&S on a part-time basis, again at Foss Park, and carried on. I left M&S, decided it was too sort of hectic and stressful, the job as it progressed for me. So I left Marks and Spencer's in '98, did sort of 6 years of voluntary work, and I did a counselling course, worked for Cruise for a little while, but again got sort of to the stage where I thought I needed to do something that was a bit more frivolous and fun and not as stressful really. So I just happened to meet a friend who has a business in jewellery retailing, and she said to me, "Would you like a job?" And I said, "Not really, don't think so." And she said, "Just for Christmas?" I said, "Well, I might." And she said 3 days a week. So I said, "Oh, okay then." Went back to work, loved it, and I'm still there. I then, as I say, went for a routine mammogram in March of last year. Didn't think anything about it, and a week later was called back with some sort of problem, and I thought it would just be a technical problem on the film. When I got there, I was told I would need to see a doctor straight away, and she said to me, "Do you know why you're here?" And I said, "Well, I think there's a technical problem of some sort." And she said, "Well, can I just show you the film?" Which she did, pointed out this sort of area to me and said, "Do you know what this is?" And I said, "Not really." Well, she said, "We think there's a 95% chance that it will be cancer." So that was a massive shock actually, because I hadn't even thought about that. I just naturally assumed it would be okay. She then said, would I mind having the biopsies? And I had a biopsy from the breast and the underarm. They couldn't find the lump, so I had to have an ultrasound scan, and then it was located. And she said then I would receive a letter in about a week's time telling me what the diagnosis was. And they were all very, very supportive and excellent at the hospital. It was very quick. A week later I did receive the letter and went back with a friend, and yes, it was cancer. And I was advised that I would need to go into hospital for a lumpectomy and axillary clearance, I think it was, which I said okay. By this time I was sort of feeling that I would be strong about it. I wasn't too worried. Well, I was worried, but not sort of, I was thinking, yes, you'll get through this, because I know people that have had breast cancer. But I went to see my GP because of my history of depression, and she knows me so well, and she's been so supportive over the years. And she said to me, "I think we ought to put you onto your antidepressants now, a low dose, just to sort of help you." And I agreed readily. So that's what we did. And then, of course, as the sort of whole thing started to roll, I went into hospital. That was fine. Had the op, which wasn't as bad as I thought it would be. I was lucky. I was sort of like the first patient down there. My brother and family were very supportive. My brother had said to me, "Right, I'm going to get you through this. You will be absolutely fine." And I sort of believed in him, and I thought, yeah, I am going to. And my daughters did as well, everybody did. But unfortunately, my body chemistry doesn't seem to work like that, what I think. I can't control how I actually feel. And so gradually, after the op, I knew I was going into a depression.
talk about what happened again about the diagnosis. I mean, I heard you say there about how the diagnosis came about.
Yes.
How do you feel the process was handled overall?
I think the process was very quick. I believe you do need to be told the facts. However, I think if I'd thought there was going to be anything remotely wrong, I probably would have gone with somebody on that second visit, but I don't know how you'd get round that really. But having said that, when I did go, the doctor I saw and the nurses were very, very supportive and caring, and I could have had somebody with me then if I'd wanted to, but I felt no, I was there anyway, so deal with it, and they were very supportive. So I think they were I couldn't fault the care I've had, actually.
Did I hear you attended on your own for that key appointment?
Yes, I did.
Did you make a decision to attend on your own?
I did, but mainly because I didn't think it would be anything other than, yes, you probably need another mammogram, there's been a fault on the film, or it's not quite right, or so if I'd thought that there was going to be a problem, I might have taken someone. I'm not saying I would, but I might have done. Yes.
And did you feel the treatment options were presented then, when you had the diagnosis, so you knew what was going to come next?
Yes, I did. It was very clear. I mean, they were very straight and told me that as far as they were concerned, I would need a lumpectomy, not a mastectomy, and the axillary clearance. And then obviously after that tissue was removed, they'd be able to analyse that and see whether I needed any further treatment in terms of an operation. But they felt that I wouldn't. That's how it was put over to me. So I felt quite positive about that.
What did you find out about your cancer type and stage? The actual type of the cancer?
Yes, it was a hormone receptive cancer, which I was told was one of the better ones to be diagnosed with. And it was a grade 3, so it was a very aggressive, although that's how I was told in the clinic. But when I actually saw the breast care nurses, I think at the time after that, they don't like to use that word, aggressive. They felt that was quite a strong word to use, and they just said it was, a sort of the type of cancer that was very quick growing. But no matter what, I was told it was treatable, that I would probably need to have chemotherapy and radiotherapy. I was told at that time, both, which was a shock, but obviously I was told everything, and it did follow that pattern. It really did.
Let's talk about the treatments that you did have. You mentioned about the surgery then.
Yes.
Lumpectomy, I think you said.
Yes, I did.
How did that go?
The op was fine. I was very sort of scared because I'm not very good with needles and things anyway, but I'm a lot better now, having gone through this. The surgery was very quick. I was in the hospital for a day, literally, stayed overnight, had a drain in, and went home the next morning and felt fine, really did, not in too much pain. I was given painkillers and went home, and I was uncomfortable. The sleeping, I think, was the worst bit, knowing how to sleep, and supporting this right arm. But I didn't really have any problems initially. It was fine.
And then you had later treatment as well. What was the next step?
I did. The next step was, I think it was after 3 weeks that I started on my chemotherapy. And having seen the breast care nurses and the doctors at Glenfield, they actually asked me if I had, can I say this, private health insurance, which I did have, I hadn't used. And they said, well, if you have, you could probably use it for your chemo, because it will probably just be a slightly nicer experience at the Spires Hospital. So I said okay and followed that through, and I did in fact see the same oncologist, and he said that would be fine, he'd just treat me at the Spires. So I started I think it was 3 weeks after I'd had the surgery, at the Spires for my very first chemo. In the meantime, I'd had an infection in the scar, which had necessitated me having a course of antibiotics, and at one point they thought that might delay the chemo, but thankfully it didn't. So I started my chemo on the 3rd of May, and I was petrified. I really was. I was dreading the needle and the cannula and all the rest of it. But the nurses again were so lovely. You know, they used all the things like warming your hand, and they were just great. And so I didn't look for that first treatment at anything really that they did. And it wasn't as bad as I thought.
What did you think of the environment there at the Spire? Because we haven't had many patients who've accessed that.
Right. I thought it was well, pleasant. I had my own little room, so I could have my eldest daughter wanted to come to every treatment, which she did. My brother also wanted to be with me, and my father, and also another friend of mine called in every Thursday when I went. So that was nice that I could have people with me, and literally people dropped in, which they allowed.
And were there other patients there at the same time?
There were in different cubicles, yes. There were lots of patients. Probably the downside of that was that I didn't really get to know any of the other patients.
That's what I was wondering, actually.
Which I understand from a friend of mine. She did get quite close to 2 ladies at the Royal Infirmary when she had her treatment a few years ago. But as I'd got these 2 friends, of course I did actually talk to them in a lot of detail as well. So I thought the treatment and the environment at the Spires was good. Yeah.
So how did you find you tolerated the chemotherapy overall?
Overall, I think that the chemotherapy was tolerable for me. I had sort of steroid backup and all the anti-sickness drugs, which again I did use initially and was prepared to, but I didn't actually find that I felt sick and nauseous very much at all. The biggest problem for me was the depression, because by this time I was so depressed, and when I'm depressed, unfortunately my body shuts down, and that's how I felt that I was shutting down. And I mean, I have got an insight into that now, very much so, and that's what was happening to me.
So let's talk about depression a little bit, because I heard you mention it, and a lot of people are familiar with feeling anxious or worried, but your depression, I think, if you don't mind me saying, was quite severe.
Yes.
Now, you had depression before, postnatal depression, hadn't you?
Yes.
How did you feel those symptoms began when you felt it coming on?
For me, it is perhaps anxiety type feelings initially, but it doesn't manifest itself in panic attacks or anything like that. I can usually get through the anxiety bit, but then it literally is that I do start to close down. I don't know how to explain that really. I do. I don't want to go and do things. I'm normally the sort of person that would do things. I'm totally in control usually of everything, and I start to feel totally out of control. The feelings overwhelm me, and they're feelings of all sorts of things that wouldn't normally be a problem. Everything becomes a problem. I don't want to go out. Will I be able to do this? I can't remember how to do that. Will I be able to cook that? all ridiculous, irrational things.
Some people recognise normal worries and normal low mood, but it's sometimes unclear when does that become severe or when does it become kind of clinical.
Yeah.
And some people say that there's a quality to a clinical depression that is not just an everyday experience. Would you agree with that?
Yes, I would. Yes, because the other thing is I don't want to eat. I totally just go off food. It's just, sort of an inconvenience, really. I don't ever want to just stay in bed and not do anything. I always I always get up, get dressed, shower, etc. And then it's like I've got all day in which to do absolutely nothing because I don't want to do anything or I can't do anything.
So your interest in your normal activities and hobbies is gone?
Absolutely
really.
Gone.
And motivation, I assume, is gone as
yes,
well. Motivation to do it,
totally.
To push yourself along.
Yeah.
Although you do try to keep going in that
I do.
phase.
I've made myself always, yes, as I say, get up. I've not been one to hide myself under the covers and that sort of thing. But
is there anything positive that can come along that makes you feel better in that situation, or is that almost an impossibility?
Yes, absolutely. I would say I get cajoled into doing things probably by probably my dad particularly, who my parents have always supported me through these depressions, having lost my husband, and he's very much one for sort of trying to cajole me along and take me out for a lunch that I probably don't really eat anything. I can't make conversation. I sit there and feel totally inadequate, but they put up with it.
It sounds like the depression is affecting how you feel about yourself and
absolutely
the world around you as well.
Yes, I feel like I can't do anything any longer. I'm not particularly good at anything and haven't got anything to offer to people. This time, my two daughters, I've not been depressed for a long time. They probably haven't seen me as adults depressed, and it upset them a lot because they knew I had depression. I've always sort of told them about it, but they'd never really witnessed it. And this time it was hard for them because they'd come in and visit me. I stayed with my parents. I didn't want to be at home. I couldn't face staying at home on my own. I definitely didn't want to be on my own. That was a big thing, which I didn't mention. But I didn't want to be on my own at all. I needed to be with somebody all the time.
Can you explain what that feeling's about?
I suppose because I couldn't do anything for myself. I didn't feel as though I could, and I needed somebody to be there so that I would be cajoled along, I think. It's partly that. I'm just scared of being on my own. I mean, I haven't this time had any thoughts of not wanting to be here, but certainly when I was postnatally depressed, I did not want to, I actually did used to think I'd rather not be here. I would never have harmed my baby. That wasn't part of it. It was just that I didn't feel I was adequate. And I can remember saying to my mum once, would you like to adopt Claire? I'll be able to see her, but you can look after her because I won't be able to. And I do also feel as though I'm never going to be the same again. That is an overwhelming thing, that I will not ever be the person I was before.
I think that's a key thing. In depression, you can feel like you're stuck there and there's no hope,
no way out.
No way out and no hope for change.
Yes, that's definitely how I feel. And that's probably when I saw you, I think, when I was desperate.
And regarding those thoughts that life's not worth living.
Yeah.
I mean, sometimes that's about feeling that things are totally inadequate, so there's no point. Although sometimes it can be another step beyond that you think, not necessarily you personally, but sometimes people think that they don't deserve to be around. There's no, it's more than meaningless. It's actually like harmful to be around.
Well, yes, and I think the other thing was that I felt I was sort of so dependent upon other people, which I hated really, and certainly for my parents this time, because they are elderly. It was, and yet I could think that, but then I'd think, no, I've got to be with them because I don't want to be on my own. So it was, again, so irrational, really.
Did you have any of the other physical symptoms? You mentioned about your appetite.
Yes.
Sleep problems.
Yes, sleep problems.
Energy in the day.
Yeah, no energy.
Weight issues, that kind of thing.
Yes, I lost a lot of weight because I didn't want to eat. But my mum would painstakingly sort of do me really nice food, and I'd pick at it and eat some, but I just didn't have the appetite to eat what I would normally eat. But I knew I'd got to because of having the chemotherapy. So again, there was that sort of feeling in my head, you've got to, because you've got to get well. And everybody, my daughters would say, come on, Mum, you've got to eat something. And I would, for them. So that was slightly different, yeah.
So in this situation, the family were definitely kind of trying, they were rallying round.
Absolutely.
But I'm sure that there's families who get frustrated because they don't know what to do in this situation.
Yes.
I mean, from your perspective, looking back on that time now, I mean, what advice would you give to somebody who's looking after a depressed person?
I would say that they have got to have the patience of a saint. And I do remember when I had postnatal depression the first time, my dad couldn't cope with it at all because he'd never seen me like that. And he was totally frustrated. I can remember him just walking out of, I've lived in Brighton then, he just went out of the house and couldn't cope with me, sort of the things I was saying and thinking. And but he'd learned, obviously my parents have seen me go through all this and have learnt, and they are fantastic. They were just excellent with me. As well as my GP, who again pointed me in the right direction each time. And I've had very, very good care always, and medication. The hospitalisation was horrendous, really. At the time I accepted it.
Is this when the postnatal episode occurred?
Yes, but when I lost my husband as well, when I was actually hospitalised for the depression.
For depression, yes. Tell me about that experience, because that's not a common one. Even with depression, of course, most people don't come into hospital with the depression.
No. Well, I had been at home. My parents had moved in with me actually at that point, which was when I was living in Broughton Astley. And my girls were young. They were only 5 and 7. So they moved in to look after the children, really. And I got to the stage where I just literally could not swallow food. I didn't want food. They didn't know what to do with me, really. I was on medication, and then I really sort of one evening just thought, I don't know what this medication is doing, and I didn't want to take it. And I think for my parents, that was obviously a very difficult time. And the next morning I went to see my GP, and she said, I think you really need to go into hospital. It's too much for your parents with the children as well. And actually I was too poorly to even say, no, I don't want to go. I just sort of said, okay. And, I went into hospital. And it was an awful environment, really, because there were very, very poorly people in a very different way to me. But I witnessed all sorts of behaviour that I'd never come across before. When I was first in there, it didn't sort of matter so much to me, I suppose, although it was a shock. But as I started to get better, I just didn't want to be there. And so gradually, that gave me, I think, the will to get out as well, because I didn't want to be there. So I started to go home and go back to hospital. But I think it was mainly the behaviour of patients who were extremely poorly.
Yes, I think in this country there's a mixed blessing regarding mental health wards.
Right.
And basically, in a nutshell, they tend to be run down, a little bit underfunded and slightly understaffed.
Yes.
And therefore they're a little bit chaotic, and a lot of different type of patients are kind of merged together. Yes. In quite extreme situations, in terms of severity, because particularly nowadays, only the most severely unwell patients come in.
Yes.
And so what that means is it's not always, if you're a patient individually, you're receiving care, but you're subject to everything else that's going on with a lot of unwell people. And it can be quite disturbing in a way.
Yes, it was. And I must say I was very, very shocked by it. It was a difficult time. But again, I had lots of visitors, which most of the patients didn't, really. I did. I had visitors every day. And by hook or by crook, they'd get me down to the restaurant or something, you know, in the hospital and out of that environment for a short time. And even though actually I just wanted to get back to the ward whenever I was out of it, and that's how it felt. It was a very unwelcome experience, but having said that, I can look back on it now and it's given me a lot more empathy actually to people with mental illness, any sort of mental illness, because there were people that were sectioned for, I mean, it was the whole dichotomy, and that's it. Yes. Yeah.
What's your view of the treatment approaches that are offered for depression conventionally? They tend to be medication approaches, psychological therapy, which is talking therapy, and some social or environmental aspects, looking at what your situation is and trying to improve that.
Right. I think for me, the sort of social type aspects weren't a problem because there wasn't really a reason for the depression. Well, there was, but not a social type problem for me. It was sort of, I was explained that it was like a chemical thing, so I needed the medication. Once the medication was right, for me, it was like having a light switched back on, and it literally was like that. I was on a venlafaxine, which and very high, quite a high dose, I believe, 375 milligrams at one point, plus lithium, which they tried at one point. And once I was given the lithium, it was like a light switch going back on. I then sort of, it was like getting up one morning and feeling better.
Yes, so you're an advocate of medication, because I know
I am.
People's views of psychiatric medication, mental health medication vary a lot. But in your case, they were effective.
Absolutely. It did seem to for me to be the answer, and I did have therapy, talking, psychotherapy, counselling, whatever you'd call that. Each time, actually, I've been depressed. That's always been part of the treatment as well.
Were you well enough to receive that?
Initially, when I go in, I would have said no. I didn't probably respond at all, particularly, but gradually, yes. I think as I started to feel better, then it did help, because you could sort of talk about things, and obviously the people that were treating me guided me and talked to me, as probably you would, to find out what sort of things were behind this depression.
How long did you feel that the depression was there for on these key occasions? How long did it last for?
I would say 4 to 5 months at least.
Which is a long time, isn't it? A very long time to be depressed.
Yes.
Especially when during that time your life is really dominated by it.
Totally.
And you feel that you're stuck there.
Yes, yes. Absolutely. I mean, and my sister used to come and see me every night when I was hospitalised, actually. She'd come from work every night, and apparently I used to say to her the same things every time, which was, why am I like this? I'm not always like this, am I? And she would say, no, you're not. And it would be that same pattern, because I could not, I was desperately trying to rationalise it and couldn't.
Do you remember those phases, or is the memory for those periods when you were that unwell a little bit patchy?
Yeah, it is patchy, very patchy, but I do remember feeling like, particularly when I was prompted, I can picture myself back there, sat with her in that ward, and going through the same thing, and then she'd say, well, shall we go for a walk? And I'd sort of say, come on then, and yes, I can, and it's horrible, really, but I can at least look back at it now and not feel too badly about it.
What do you remember about the improvement process? Was there something that you can remember? Oh, I remember when I started to do that thing, that I hadn't done in a while, and it was like a symbol of improvement.
Yes, I think it was when I could go home for visits, which was quite an incentive, even though the thought of it also petrified me as well. But initially, once I'd got home and found that it was okay to be at home again and coming back in, and I was able to sort of, I think, just take more care of myself. I was interested in clothes again, and just gradually started to feel I was interested in other things and other people, probably, rather than being focused mainly on how awful I was feeling. And being me in this hospital.
Having been through all of that,
yes,
everybody would want to avoid that situation again, and obviously we need to think about that. But from your point of view and from a viewer's point of view, is there anything that you would advise regarding, feeling slightly vulnerable because of an event like the cancer diagnosis or, a life event? And having that sense that, depression could come back. Is there anything you would advise regarding prevention?
Yes, I think the last sort of 2 episodes I've had of depression, including this when I had the cancer, when you actually look back at my depressions, there have been, as you just said, major events really, in terms of having my children, and then losing my husband. So yes, I think for me, I would immediately go to my GP, as I did this time, because I had more of an insight. Didn't have that to begin with, but I now have. The minute I start to feel anxious or worried about things and it won't go away, or my sleep pattern starts to disintegrate, then I'd go to my GP straight away and go onto medication, because I know that that's what I'll need to do. And even then, I still know I'm going to go to rock bottom. And at that point, I can still think, yes, but you have got better before. It's only when I'm then at rock bottom that I lose that, even, that I think, I'm never going to be the same.
Do you think there's anything further that should be done for the general population in terms of anxiety and depression, in terms of, I don't know, maybe population screening or resources that are available, or public education?
I think education, definitely, because depression does tend to be the sort of thing that's people don't want to talk about, or call it other things, stress, whatever you want to call it. So I think it's good, because it does seem as though things are better than they used to be, that people will talk about things and what depression is like. But of course, there's so many sorts of depression, aren't there, really? The treatments as well. When you hear some of the treatments that people have, and I mean, I can remember being put off when somebody said to me, "Oh, you'd probably have to have ECT," which is still used. And I actually did have one treatment of ECT and then said didn't want it again. But I mean, I think the more you talk about things, the better it is, because you are aware of them and they're not so undercover and so worrying, because they're in the open. So yes.
We talked about surgery, we talked about the chemotherapy earlier.
Yes.
You had radiotherapy as well.
I did.
How did that go?
The radiotherapy for me was just okay. It was a treatment that, you had to go to every single day for, I think it was 20 sessions, so Monday to Friday. So it went on for a bit longer than 3 to 4 weeks might have been a bit longer because there were 2 occasions when the equipment was being serviced, and so of course then you can't go. But again, literally I had very early appointments, luckily most of the time. I used to go park, which is an issue at the Royal Infirmary really, but you can get round it. Have 10 minutes, literally I'd be in there for 10 minutes, have the radiotherapy, and then go home and carry on normally. And by this time I had gone back to work 1 day a week, because I didn't mention work before, but yes, I didn't work all the time I had the chemotherapy because I just was not well enough to.
How was it going back to work?
It was great really, because it gave me something else to focus on. And my colleagues, I work with a small team there's 10 of us in total, and they were all so supportive and pleased to see me back, and I loved going back.
Because it can be a key marker to go back to work and feel you've got a role again.
Yes, I think it was good for me. I sort of went back and picked up where I left off really. So I built it from the 1 day while I was having the radiotherapy, because they said I might be very tired. I did get tired, but I don't think I had particularly unusual tiredness. I didn't have any skin reaction, which I'd been told I might have. I used all the creams and things that I was given for the site, and used the simple soap and all the things that you were told to do. And I think that's important that you do those things. So I think you've got to follow the things that you're given. And I didn't have any problems with it at all. And again, the radiologists were great, and you build up a rapport with them because most of the time it's the same ladies that you see. So it was fine. I felt that I was really getting there when I was on the radiotherapy bit. I'm almost there. Can't wait to tick off. And I actually did tick off the days on a chart. I had them listed and I used to tick them off.
So there comes a time when all those acute treatments are finished, and then you generally have a re-examination or scan to see what your cancer's doing.
Yes.
And then if all's well, you go into a monitoring phase.
Yes.
Where you just come back occasionally.
Yes.
Is that basically how it went for you?
I haven't had another scan. I've had the checkups back at the Spires with the oncologist. I'm due to go in June. I did have to go on to, because it was a hormone receptive cancer, I've gone on to a hormone tablet for 5 years, and the tablet is the Arimidex, as opposed to tamoxifen, which again I was guided by the oncologist. He felt that was the best one for me. Because they weren't sure whether I was actually totally postmenopausal, I did have to have 3 extra radiotherapy sessions on my ovaries to make sure that they weren't functioning anymore, producing estrogen. And again, that was very straightforward. I didn't have any side effects really from that, which I was told I might have. I was very lucky, I think.
Did you find that there was an issue with the kind of discharge from hospital, meaning that acute period was finished?
No, it was a bit of a celebration for me, really. I mean, I sort of thanked the people, because again, when you look at the whole process right down, originally to that original, whoever the person was that looked at that film and was able to see what she saw, I've got to thank from the bottom of my heart, because you can look back then and think that everybody has been just helping me to try and get better. So it was a celebration to think I'm at the end of this now. And I couldn't wait to tick the last day off, and then it was done. And by this time, obviously I was feeling a lot better mentally, having had your input in terms of the medication and everything.
I know you mentioned this right at the beginning, but in case people didn't pick up on it, you did have this major life event during the process, which was your brother passed away, didn't he?
I did.
And this was whilst you were in the acute phase of treatment as well?
It was, and it was a major thing really, because Richard, my brother, he was the one that had said, I am going to be with you, and we are quite close. There's only 2 years, less than 2 years between us. And so he was picking me up, taking me to my appointments, and he'd been to 2 chemos with me. And he was just so determined I was going to be fine. And of course, I was at home one day in June with my parents, and we had this phone call, to say that sadly he'd died of a massive heart attack, which was horrendous for me. And my parents obviously were devastated. For me at that time, because I was so poorly, it did go in, but obviously it's been worse for me actually when I started to feel better, because then the reality of it really did hit me. And I've looked at his photographs and talking to my 2 daughters, who, again, he was their sort of guardian because I'd lost my husband. For them it was major, and for my parents it was their only son. But through all of that, I think, again, as I started to feel a bit better, I kept thinking, but Richard, I've got to get better for him as well. So that was partly there. I've got to get better. And I'm going to. He used to say, you are going to get better.
So in a way, it did give you a bit of determination to improve.
Yeah, it did.
You did improve, and you have improved.
And I have.
Tell us about what's been happening over the last few months, I guess.
Right. Well, I continued on just 2 days a week at work up to Christmas, because that's a very busy time anyway in the retail sector. And I also sort of had time at home then to acclimatise and be with my daughters, really. And excuse me, I started to sort of have times with my granddaughter again as well, because that was something that I can also remember thinking. My daughter had just had Miley, and then I was diagnosed with this. I'd just started to look after her 1 day a week, and then I had this diagnosis, and of course I couldn't cope with her either. But I couldn't pick her up, and I just felt as though I'd lose that sort of bond I'd got with her. But that is absolutely fine. So I'm back to having Miley 1 day a week. I'm back to doing all the things that I did before. I sing with an a cappella group, and I'm in another choir, and I do all sorts of things really. And as I said to Heather, because I live near my daughters, it tends to be, phone goes and it'll be, Mum, I just need to go somewhere. Can you have Miley if I just drop her here? And yes, that's fine. Or I go down. And so things are back on track really. I've had one slight hiccup. It isn't a problem, but I have got a bit of lymphedema in my right breast and under the arm. And I was referred to one of the Loros nurses, who has been wonderful. Showed me how to do the simple lymphatic massage. And she's also treated me for 4 consecutive sessions, and I'm going to go back 6 weekly. That's helped a lot. One of the things, I don't know whether this is relevant, but finding the right underwear, bra particularly, has also been, I think, quite difficult.
Well, you might as well say, if you don't mind, because I know there'll be people who are in that boat too.
I will. It has been a problem, because I needed to have a very supportive bra, particularly under the arm, because that's where I had the lump, really, and I had all my lymph glands, 30 lymph glands removed. And I've tried literally all over the place. I'm now at the stage where I'm going to collect 2 that I've ordered from Phoenix, and I'll see how they are. But trying to get something that also isn't underwired and all the rest of it. Yes, so I think that's something that would be great to have some help with, really. Because without having the mastectomy, I think you get lots of support then, I know from a friend of mine. Mm-hmm. But when you've had perhaps I am slightly misshapen and I don't want to have any reconstructive surgery, although I was offered it. I don't think it's necessary for me, and I don't want any more surgery than I need to have, really. Mm-hmm. So that's been something that's been a bit of a... just something that's niggled, really, trying to find something that's right. And, I think that might have contributed to the lymphedema, apparently, because if you've got that sort of support, it might not have been quite as bad as it got. And I didn't realise what it would be like either, so I think it was me not knowing what lymphedema was like.
Is there any advice or recommendations you'd give to patients who are watching this?
I think if you've got any after 6 months of surgery, if there's any sort of swelling still or feeling of being uncomfortable, to sort of say something to somebody, the breast care nurses, oncologists, whatever. And I did eventually, and immediately I was referred to a specialist lymphedema nurse, and I think I should have done that sooner. So I'd say sooner rather than later.
Would you say that advice would apply to different types of complications as well? The emotional side?
I think so, physical? Yeah, definitely. Definitely for yes, I mean, obviously depression, which was what we talked about. I haven't had any other complications, so I've been lucky, really. My hair's grown back, and that's a bonus because it's curly. My nails have all come back, because I didn't lose my nails, but they were very discoloured. And they did all eventually partly come off at the top, and I had horrible nails, and I've always had quite strong nails, but they've all come back now.
Well, that's good.
That's fine. My hair's growing very quickly, and it's now curly, and everybody likes it.
Wasn't it curly before?
No, it was dead straight.
Wow.
So it's quite a major change for me.
What does the future hold now?
Well, the future holds for me. I've decided, it's made me think about things. I've cut down 1 day a week at work. I'm only doing 3 days a week now, every week. And I think I shall stick to that, because I did used to be, and am, the sort of person that tends to get, roped into things. And if there's extra hours at work, they'll say, do you want to work it? And even though I probably didn't want to, I say, oh, okay, then if there was nobody else that would do it, I think I should probably be a bit more careful about that and say, no, actually, I don't particularly want to do it. And I shall do things that I really want to try and do. Because I've always, as I say, always been on the PTA and chair of governors and things like that I've always got pulled into, really. And I don't necessarily think that's what I should be doing in the future. I think I should try and do a bit more of things that I'd like to do.
Reprioritise what's important.
Absolutely, reprioritise, yes. Work is important, but it's not to the detriment of everything else. And spend time with my family. Particularly, we are a close family. My parents celebrate their diamond wedding this year, so we're going to have big celebrations for that, and I shall get involved in that. I want to do some fundraising for cancer research, this department or whatever, so I'm organising a concert in October. So I'd like to do things like that, really. I might even do some volunteering at Loros, because I thought that was a wonderful place to go as well. And something like that would be great.
Well, that's been amazing to hear your whole story, particularly with the vulnerabilities you had before the cancer. And to hear in detail about the depression, I think, is really important as well for other people who are potentially suffering that situation. But the key thing is you came through that.
Yes.
And you've come through the cancer experience as well, which is great.
Absolutely.
And it's wonderful to see you so well and back to your normal self now.
Thank you, and thank you for your help. I mean, everybody, that's the thing. I have had a lot of help. And that's important from friends, family and everybody.
Definitely.
Yeah.
So all the best for the future.
Thank you.
Take care.
Thanks.